Chapter 3 is on infection control. All healthcare personnel must help to prevent infection by providing a clean environment while caring for patients. Doing so reduces the chances of infecting patients, visitors, and healthcare workers. These are the learning outcomes. Let's go straight to the main part of this lecture. The first topic is disease transmission. Okay. As a phlebotomist, you should adhere to the CDC standard, be aware of all possible biohazards, be aware of all possible non-biologic biohazards that may cause injuries or illness to patients or the healthcare team. Protecting the safety of patients, colleagues, and yourself is a key aspect of your health careers. To prevent infections acquired in a hospital or other medical settings, phlebotomists should be aware of all possible biohazardous settings, standard, and this is our top priority for uh, protecting ourselves. Chain of custody, chain of infection. The elements of chain of infection are here, 6 elements. Number 1 is the infectious agent. You see in this 6th circle on top, the middle one, first one is the infectious agent, a disease causing microorganism. The second one, that is the reservoir, the site where organisms grows and multiplies. In third step, the portal of exit, skin, respiratory tract, gastrointestinal tract, eyes, ears, urinary tract, reproductive tract. I mean, are many ways through which the organisms will exit from the reservoir. That's the portal of exit, third element. Fourth one is the mode of transmission. How is this transmitted to the next person? It can be direct or indirect through droplet, air, or contact. Number 5 is portal of entry. There can be a break in skin, or it can go through respiratory tract, eyes, ears, urinary tract, or reproductive tract that allows the pathogen to enter the body. And lastly, the susceptible host, anyone at risk for developing an infection from the pathogens. So 6 links, that's the chain of infection. If we can break any one of that link, infection will be controlled. It cannot spread. Contact transmission occurs when a susceptible host comes in contact with a reservoir of pathogens. Direct contact occurs when the susceptible host touches the infected person directly. Indirect contact uh, occurs when the susceptible host comes in contact with the item that has been handled by the infected person. Uh, like the fomites, contaminated item, or person to contaminated items to person. The most common cause of indirect contact transmission is failure of healthcare personnel to wash their hands and change gloves between patients. That's the point to note. Now, droplet transmission. This is a form of contact transmission that occurs when the infected person coughs, sneezes, or breathes near, usually within 3 feet of the susceptible host, or when infected blood or body fluid splashes onto the susceptible host during specimen handling. The droplets are not suspended in the air as they are in the airborne transmission. Uh, so nasal mucosa, mouth, conjunctiva of the eye, these are the areas where these things are absorbed by the susceptible host. And common diseases transmitted by droplet transmission include influenza, mumps, rubella. Small particles carried on air current or inhaled by host, that's the airborne transmission. Uh, so it is different from the droplet transmission in that the particles that contain the pathogens are airborne and may be widely dispersed on air currents before reaching the susceptible host. Um, this airborne transmission can also occur when the top of the tube of the infected blood or other body fluid is removed, creating an aerosol. Protection from the aerosol during specimen handling includes wearing appropriate PPE, using a specimen shield. So, regarding the word aerosol, what is that? It's different from droplet. It's tiny airborne droplets of fluid that are often so small that they go unnoticed because you cannot smell or feel them. Yet they can carry microorganisms. Some examples of airborne transmission include Legionnaire's disease, chickenpox, shingles, tuberculosis. Vehicle-borne or vector-borne transmission. Vehicle-borne transmission occurs when a fomite comes in contact with the contaminated items, such as used dressings. The fomite then serves as the vehicle to transmit the disease to the susceptible host. To prevent this, dispose of soil dressing properly, clean equipment thoroughly according to the facility's policy. Vector-borne transmission occurs when an insect, such as a mosquito, serves as an intermediate host. The pathogen survives inside the insect until it is transmitted to a susceptible host. Some examples are West Nile virus, malaria. One of the most disturbing trends in recent years has been increasing resistance to some pathogens to known antibiotics. Once acquired, infections caused by these pathogens are difficult to treat because they are drug resistant. For example, MRSA, MRSA, methicillin resistant Staphylococcus aureus. This MRSA infection can lead to tissue loss and sepsis. MDRAB, VRE, Pseudomonas aeruginosa, these are some other examples. Therefore, the best way to deal with these infections is to prevent them entirely. Sepsis is the life-threatening response to the body of infection. Ordinary precautions that we can take will be the correct hand hygiene. Remember to use alcohol-based hand sanitizers only if there is no visible soilage on the skin. Keeping non-contact skin covered with bandages until healed. I mean, if it is not intact, in the breach of the skin, we should keep it covered. Wearing appropriate PPE when working with other people's wounds or bandages. Using a biohazard spill cleanup kit when blood or body fluid is spilled onto a surface. Next topic is controlling infection. Hospital-acquired infection, HAI, is also known as nosocomial infection. So think about the word hospital-acquired. So it occurs when the patients are hospitalized or receiving treatment in healthcare facilities. They get another infection from the hospital, right? So they were admitted with some problem, but getting another infection from the hospital, that will be HAI, hospital-acquired infections, nosocomial. 1 in every 25 patients will develop this HAI. A general term of hand hygiene includes both hand washing and use of alcohol-based hand rubs. It must be performed correctly and it will reduce risk of transmitting infection. Um, these are the steps of hand hygiene and washing. Hand washing has been proven to be most effective way to prevent the spread of infection. Uh, at the start of the day, you, you can use 2 minutes for hand washing. Between patients or procedures on same patient, 20 seconds will be fine. When hands are soiled, 1 to 2 minutes. These are the steps like removing all the rings and jewelry, turn on the water and adjust temperature to warm. Wet hands liberally with fingertips pointing down. Do not lean against sink area. Apply soap and work up lather using circular motions and friction, interlacing fingers to clean between them. Rinse each hand, allowing water to run from the wrist to fingertips. Then we can use an orange stick or other tool to remove contamination from under the fingernails. Repeat this if hands are very soiled. Thoroughly wash wrist. Dry hands thoroughly by patients with paper towels. Discard towels without touching receptacle. Turn off water and clean with clean dry paper towel if indicated. And clean area using dry paper towels as needed. This one is the alcohol-based hand rubs. If there is no visible dirt or contamination, we can use half to 1 teaspoon of alcohol cleanser. Rub hands together vigorously, making sure all surfaces are covered, including backs and front of the hands between fingers. Continue rubbing until hands are dry. Respiratory hygiene and cough etiquette standards created by CDC. It applies to everyone. Order of donning PPE, personal protective equipments that will follow this order, which is gown, mask, goggles, and gloves. While doffing, that is the removing of PPE, you will follow the opposite direction, gloves, goggles, mask, and gown. I'll share a few videos later on after we complete the lecture. You will see how to wash hands as well as how to don and doff PP. Be sure to use gloves that fit you properly. Poorly fitting gloves can cause clumsy handling of the equipment and the potential for biohazard exposures. So these are the steps about using personal protective equipments. As I mentioned that I will share some videos with you. We can skip these slides for now. Let's go to the CDC levels of protection for prevention of AJIs. Isolation and transmission-based precautions are the second level of precaution that are based upon how infectious agents are transmitted. Combine good hand hygiene with a standard precaution uh, and the use of gloves. In isolation precaution, based on how the infectious agents are transmitted, airborne, droplet, and contact. Uh, Standard precautions are similar to the older universal precautions, but universal precautions were applied only when blood was visible. Standard precautions are used whenever there is chance of contact with non-intact skin, mucous membrane, blood, or any body fluid, secretion, excretion, except sweat. In addition to hand hygiene and wearing gloves, CDC advises against artificial nails, recommends that natural nails must be no longer than 1/4 inch past the fingertips. While and always follow standard precautions with every patient when performing phlebotomy. Isolation precautions are used with patients who have or are suspected to have a specific infection, and these may vary with the method of possible transmission. For airborne precautions, we can use HEPA respirator or N95, droplet precautions, goggles and mask, contact precautions, gloves and gowns, protective environment precautions, we can use gloves and gowns as well. Double bagging. Double bagging is used to remove contaminated waste and equipment from an isolation room to avoid spreading pathogens. One person wearing PPE is in the room and places all the contaminated items in a biohazard label bag, close the bag. The second person, also wearing appropriate PPE, stands in the doorway to the room and holding a second biohazard label bag wide open. The first person carefully places the bag into the second bag without contaminating the outside of the bag. The second person closes the second bag and transports it to the disposal area. So this is called double bag. So that is a short chapter, but as I mentioned, I'm going to take some time. Just give me a few seconds. I'm going to share some videos with you regarding this infection control. So one moment.
No sound, Professor.
I'm sorry, say it again.
You were on mute.
Oh, yeah, I'm just, give me a moment. I'm looking for some videos to share with you. Thank you. Just first one will be hand hygiene, then donning and removing PPE. Okay. All right, so yes, two videos back to back. We are going to watch now. Let's watch this video.
video, I want to demonstrate how to perform hand hygiene by using soap and water. There are two ways a nurse can perform hand hygiene. One way is through using soap and water, and another way is through using an alcohol-based hand rub. So when do you want to perform hand hygiene? You would always want to perform hand hygiene before and after patient care, after coming into contact with like a body fluid or an open wound, or touching something close to the patient like a bedside table, the hand railing on the bed, or after removing your gloves, before eating, and after using the bathroom. Now, when would you use soap and water versus the alcohol-based hand rubs? Well, according to CDC.gov's guidelines, you would use soap and water when your hands are visibly dirty, after known or suspected exposure to Clostridium difficile, which is C. diff, if your facility is experiencing an outbreak or higher endemic rates, after known or suspected exposure to patients with infectious diarrhea during norovirus outbreaks, if exposure to Bacillus anthracis is suspected or proven, which is anthrax, before eating and after using a restroom. So now I want to demonstrate how to perform hand hygiene using soap and water. So first, you need your supplies. Of course, you need soap, you need some paper towels, and you need running water. Now, faucets vary depending on where you work. Some are automated. You just have to swipe your hand underneath, the water will come on, or you use a pedal. Or it has little faucet handles that you have to use to turn on and off. Now, generally, it's best not to wear jewelry during patient care because that jewelry can harbor germs. In some areas in the hospital, like surgery, for instance, actually prohibits a person from wearing jewelry altogether. But usually on some units, you can wear like a simple wedding band. So if you do wear a wedding band and you're wearing it during patient care, you need to keep that wedding band on whenever you're performing hand hygiene because you want to clean it, because underneath that ring, it can harbor germs as well. So first, what we're going to do is we're going to turn on our water, and we want our water to be warm, not too hot, because if it's too hot, that can dry out the skin and that can cause you to get cracks in your skin, be really uncomfortable for you. So make sure it's warm, and you want to be careful not to let your scrubs or anything like that touch the inside of the sink because it's very dirty and you'll become contaminated. So once your water is warm, you want to wet your wrists and your hands, and be sure you have your hands lower than your elbows because we don't want the germs that are already on our dirty hands to travel up our arms. After you've wet your hands, you want to put the soap on your hands, and you're going to put about 1 teaspoon of soap, which equals about 5 milliliters. And a lot of soap dispensers are automated and they give you the amount of soap you need. So we're going to take that soap and we're going to lather our hands and our wrists with the soap. Now we want to scrub. And what we're going to do is we're going to scrub the soap on our hands using circular motions because this is going to help remove those germs and the things that are sticking to our hands. And we want to cover all the areas of our hands, especially those small crevices, because that's where bacteria likes to hide. We're going to do this for 20 seconds. So first, we're going to go and scrub our palms of our hands. Notice I'm doing a circular motion. Then we're going to get the back of our hands and do both using those circular motions. Then we're going to do our thumbs, and we're going to do each finger individually, making sure we are getting around the fingernail area as well. And then you want to get those knuckles. So really rub the knuckles up against your opposite hand. It's also going to get the outside of that fingernail as well. Then we want to get in between our fingers, because again, germs love to hide in little crevices that are hard to get to. So we're going to make sure we get that. Then we're going to pay attention to our fingernails. And we're going to take our hand, we're going to go to the opposite hand, and we're going to just get underneath the fingernail right in there, just scrape around, remove any germs that could be underneath those fingernails. Then what we're going to do is we're going to get our wrists and go about 1 inch above the wrist as well. Now we are ready to rinse the soap off. So we're just going to put our hands underneath the water and let the water go downward. We don't want it to go upward. Rinsing all of the soap off from the wrist down to the fingertips. Once you get them rinsed, you want to take your paper towel and you're just going to pat your hands dry. You don't want to scrub your hands with this paper towel because that can damage that top layer of skin. And we're going to discard this wet paper towel. Then we're going to grab a dry paper towel and turn off our faucet, and being careful not to touch the faucet with our clean hands. And then we're going to discard this as well. Now, we wouldn't have used our wet paper towel to turn off the faucet because the germs that are on the outside of the faucet could have transferred through that wet paper towel and got onto our hands and undone the job of what we just done with cleaning our hands. Okay, so that wraps up this video on how to perform hand hygiene using soap.
Out with the old, Hertz cars are new.
Don't let living with cancer define you. Discover an injectable immunotherapy.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video, I'm going to show you how to don and doff PPE as an NCLEX review. And as always, in the YouTube description below or at the end of this video, you can access the free review quiz. So let's get started. First, let's start out talking about the type of PPE you will need. Remember, you will select the specific type of PPE based on what you're going to be doing for that patient or what type of transmission-based precaution the patient is in. So here are the following items you will need for PPE. You will need a gown. A gown will help protect your clothing from any type of splashes of body fluids like blood, urine, mucus. And you'll want to select the appropriate size gown based on what your employer provides you. And there's various different types of gown, and this gown I have right here is a blue plastic one. Next, a face mask or respirator. So you will select either a face mask, which you will wear at all times if a patient is in droplet precautions, or you're going to be doing something where there's a risk of you getting splashed in your mucous membranes like your nose or mouth with some type of body fluid, so you'll want to wear that. Or a respirator, an N95 mask. And this mask is to be worn at all times when a patient is in airborne precautions. And this mask will help protect you from the droplet nuclei that those diseases produce. So you'll want to select whichever one you need based on what you're going to be doing. Next, goggles or a face shield. Goggles or a face shield will protect your eyes from any potential splashes of blood or mucus. So you'll want to select accordingly whatever you have access to. This is a pair of standard goggles, or sometimes employers have the face mask with a shield attached to that. So you want to pick that if there's a risk of getting things in your eyes. And finally, gloves. Gloves will help protect your hands from any types of fluids or contaminants that you don't want to get onto your hands. And whenever you select your gloves, you'll want to select the right size of gloves based on your hand size. Here are some key points to keep in mind when donning and doffing PPE. You'll want to put on the PPE before entering the patient's room. Once in the patient's room, keep your hands away from your face and don't touch your PPE. And try to minimize touching unnecessary areas in the patient's room to decrease contamination. And when you remove your PPE, you will remove it at the patient's doorway or outside the room and perform hand hygiene immediately. And if a respirator is worn, you'll want to take the mask off outside the patient's room after closing the patient's door. And if at any time when you're removing your PPE and your hands become contaminated, you will want to perform hand hygiene before removing the other pieces of PPE. Now let's talk about the sequence of how you would don or put on PPE. Okay, the first thing what you want to do is perform hand hygiene. Then you will put on the gown, then the mask or the respirator, depending on which one you're going to wear. Then you will put on the goggles or face shield, and then lastly, the gloves. Now let me show you how to do that. First, perform hand hygiene. Okay, first we're going to put on the gown, and we're going to put it over our head, and we're going to slide our arms through the sleeves. And this particular gown has hooks where you stick your thumb, so be sure to use those because that will keep your gown secure while you're providing patient care. Then we're going to make sure we tie all the ties in the back. Next, we're going to place on our face mask, and you'll want to put it over the bridge of your nose and make sure that you form it around your nose to fit, and put the straps around your ears and pull the bottom of the mask down to cup around your chin. So everything is covered, your mouth and your nose. When wearing a respirator, always follow the manufacturer's instructions. And whenever you're wearing any type of respirator, you always want to get fitted by your employer, which will usually require it annually, and perform a seal check after putting it on to make sure it works properly. So you will take the mask, place it over your nose and mouth, cupping it in your hand. Then you will take the nose piece and form it around your nose. Take the top strap and pull it to the top of your head. Then take the bottom strap and pull it to the base of the neck. Next, perform the seal check. Place your hands over the mask and gently inhale and exhale, feeling for any air leakage. Next, you will place the goggles or face shield onto your eyes, making sure they fit snugly but not too tight. And finally, don your gloves, making sure that you pull the cuff of the glove up over your gown for extra protection. And this is how everything will look.
You don't find yourself on a boat cruise by accident. You book it on Get Your Guide.
Not all F words are bad. Some are great, like fast, free, fiber for 4 months. Switch to...
Now let me show you how to doff or remove your PPE. The sequence in how you will be removing it will be gloves, then goggles or your face shield, then gown, and then the mask or respirator, and then wash your hands. Before removing your PPE, it is very important to know which areas are considered clean versus contaminated. So the areas that are considered contaminated are the outside of the gloves, the front of the gown and the sleeves, the front of your face shield or goggles, and the front of your mask or respirator. The clean areas are the inside of your gloves, the back of your gown, which includes the ties, the straps of your goggles and face mask. First, you will remove the gloves, and by doing that, you will take one hand and you will pinch the cuff of the other glove. Then you will just peel it away and grab that glove in that gloved hand, and then take your finger underneath the glove, because remember the inside of the gloves are clean, and just peel it off and then discard. Next, you will remove your goggles, and remember you will remove them from the straps because that is a clean area. So you will take them, remove them off, and then discard. Now we're going to remove the gown, and remember the back of the gown and the ties are clean. So we're going to untie the gown. Now what we're going to do is we're going to remove the gown, and we're going to do this from the inside out. So we're going to slide our arms up through the sleeves and pull the gown from the neck and the shoulders, and this specific gown will pop off. And we want to be careful not to touch the outside of the gown because it is contaminated, and we'll roll the gown into a bundle and then discard. Then we're going to remove our mask. And remember, the straps of the mask are clean. The outside of the mask, the front is contaminated. So we cannot touch that. So we'll take both of our fingers and remove the straps of the mask and then discard. Now we're going to remove our respirator. And remember, you will do this outside the patient's room with the door closed. And what we want to do is we don't want to touch the outside of the mask. So we're going to slightly just lean forward and we're going to remove the bottom strap first with both of our fingers. So grab the strap, pull it over your hood. Do not touch the front of the mask. Then we're going to remove the top strap in the same fashion. And then we will discard. Then you will perform hand hygiene. Now this wraps up this demonstration on how to don and doff PPE. Thank you so much